Tiffany. How are you doing today?
I'm okay.
You're doing okay? Do you know why your parents brought you here today?
Recently I've been chatting with some new people.
Okay. Yeah, that's great that you're meeting new friends. Are they mostly online or in person?
Mostly online. I have reached out saying if they want to hang out, maybe.
Okay. And have your parents ever talked to you about like sex or protecting when having sex?
Not really. I think they just don't know how to talk to me.
Okay, have you learned anything in school at all?
Not really, no.
Okay.
Doesn't make sense to me.
Yeah, that's no problem. So, let's say if you were going to have sex with one of the people you've met online or met in person, what you want to do is make sure that you do have a conversation with them, just to make sure that they don't have any kind of STIs, which are sexually transmitted infections. It's something that can be contracted during sex, orally, anally, vaginally. It happens. So we have to be very careful when you're going to start being sexually active. So what we have here today that I can show you. So because your parents did let me know that they have not really given you the sex talk yet, I decided that we're going to try and inform you a little bit about these sexually transmitted infections, since they can be very dangerous, okay? So because you're more of a visual learner, we have a photo of you here today, and each spot is a different place where you would see a symptom of a sexually transmitted infection, okay?
Okay.
Do you want to pick a spot for me?
Didn't know I could get it on my thighs.
Okay, so let me find that one for you. So here, on your thighs and on your hands and your feet, you're actually able to start getting rashes. After you have sex, it could start happening in a couple weeks, a couple days, a couple months. It's not always immediate. So if you start to notice any rashes on your hands, your feet, your thighs, just let your doctor know, because it could be something, or maybe it's just like a regular rash. Could be a heat rash.
It's important to talk
It is
to
important to talk to your parents. It's also more important to talk to your doctor. Since you are an adult now, you don't always have to go to your parents. It's more important to let your doctor know.
If I don't feel comfortable talking with them, can I just go to like you or a doctor instead first?
Of course, you don't have to tell your parents first if you don't feel comfortable.
Okay.
Nothing that we say today is going to leave this room, so don't worry about that. Just always let your doctor know, especially if you are sexually active, because it means they're going to have to do a couple more checkups that they don't usually do. Okay? Do you want to pick another spot?
A little confused about the lower area.
Okay. So we do have a couple different ones for that one. So for our genital area, it's where if you have a penis or a vagina, it depends if you're a girl or a boy. So one thing that you can find would be some burning while you're urinating. It just means that if it happens, it could be a UTI, or it could also possibly be a sexually transmitted infection. Okay?
If I'm with these people.
Yes, if you're having sex with someone, this could cause that as well. Also, do make sure that when you are having sex, that you are peeing after intercourse. Okay? Another one that you can have in that genital region is unusual fluids from the vagina or penis. So if it's like a pussy kind of discharge, or sometimes a little yellow, that's something you do want to keep track of and always let your doctor know, okay? And that would usually happen if you're contracting an STI. So you just want to make sure you look out for that, okay? Another one that you can have is also bleeding while urinating. So this isn't as common, but it is something that is, as soon as it starts happening, contact your doctor, okay? Or let me know and I will contact them for you. Okay? I just want to make sure you understand these ones.
What about the mouth? Because that one, can it be like kissing or?
Yeah, so with the mouth, that's actually the most noticeable one. So let's say if you meet someone and they do have a couple of different bumps around their lip, you don't have to ask them to immediately have sexual intercourse with this individual, just make sure you have an open and honest conversation, okay? And so this is just what it looks like here. It could look like a cold sore. That's actually a form of herpes as well. So I just want you to be careful with these ones, okay? And when you're having vaginal or anal intercourse, there are some protection that you could use. For example, a condom. So here we have one, and basically all you have to do is open it, and I'll show you 1 second. Oh. So once it hits the ground, you would not use it on your actual genital region, okay? But you would need to open it, put the tip, and slide it down until it's all the way extended, okay? And you want to make sure that goes all the way down. As soon as you finish intercourse, you're going to pull it off. Make sure none of the discharge gets out onto the person's genitals. And then you're going to throw it out immediately, okay?
Can condoms ever go bad or be broken?
Of course. So depending on you always have to make sure you do check the expiry date on the actual condom. So if you look right here, it tells you that it expires in March of 2020. We do have an example of one that is expired at the moment. And it's this one here. We just keep it to show you that, or this one is about to expire actually. This one here has expired last year. So you want to make sure you check the expiry date every time. As soon as it's expired, you want to throw it away, okay? And then you don't use that. One thing is condoms can sometimes be broken. Let's say if it does break and you don't know if that person has an STI, it's always worth it to actually ask your doctor to do any kind of test, especially if you start to notice that there's something going on. Most STIs, as soon as they are noticed, depending on some of them, for example, AIDS and HIV, you can't really get rid of, but others can be cured early.
Okay.
Do you have any questions for me?
I think I'm okay for now. Can I call you if there's anything?
Of course, you can call me anytime. You do have my office hours and my phone number, okay?
Okay, sounds good.
Perfect.
Thank you.
No problem. I'll take that from you.
Do you mind if I actually keep that?
That's perfect, actually.
Just
So,
in case.
If you want to go over it sometimes, we do have the cards in there as well. There also are some condoms in there that are not expired. And if you are going to start having sex, you can go ahead and use those, okay? Just make sure if you are going to have sex with someone, have an open and honest discussion about it might seem a little awkward, but if you do have any STIs.
Okay. Sounds good.
Have a good day, Timothy.